At-risk precautions. Why are we talking about this? Suicide is the 10th leading cause of death in the US for all ages. Every day, approximately 123 Americans die by suicide. There is one death by suicide in the US every 12 minutes. Depression affects 20 to 25% of Americans ages 18 plus in a given year. The highest suicide rates in the US are among whites, American Indians, and Alaska Natives. There is one suicide for every 25 suicide attempts. Suicide among males is 4 times higher than among females. This is the Columbia Suicide Severity Rating Scale, or CSSRS. This went live in July 2020, and it is recommended in the Joint Commission Best Practice Library. You will ask the patient questions 1 and 2. If you get a yes to those questions, then ask questions 3, 4, 5, and 6. If you get a no to those questions, then go directly to question 6. This will determine if your patient is a low risk, moderate risk, or high risk. We make sure to screen all patients who were direct admits or who were not able to be screened in the emergency department. If your patient is rated as a low risk, all we need to do is make sure they have a behavioral health referral at discharge and then also notify the provider of the risk level. If your patient is rated a moderate or high risk, the RN will place custody pending behavioral health evaluation order. RN will also place an at-risk precautions order, initiate one-to-one observation. This can be a security or a healthcare team member that has to be in arm's reach of the patient at all times. You will notify security, notify the provider of the risk level, and then also get a consult for behavioral health evaluation. This will be something that the provider has to do. If the patient is at risk, arrange observation of the patient, search the patient, secure their belongings, and create a safe environment. The bathroom protocol must be followed. A healthcare member must escort the patient to the bathroom, not a security member, and then we must monitor all visitors that come. For a safe environment, evaluate the patient's immediate safety needs. Make sure the patient's eating utensils are plastic and or paper, no aluminum cans. Make sure there's nothing like shoelaces, any sharps containers. Take the callate out of the room because someone will always be in the room with the patient and they will know how to contact us. Nothing like scissors, lighters, matches, oxygen tubing, belts, pins, anything that can be a threat to the patient's safety. Also, place the patient in an area that's accessible for easy observation, such as a room near the nurse's station.